A video summary of the original blog found here. https://bmidoctors.com/the relationship between semaglutide and gastroparesis. Imagine a world where a single medication could revolutionize the management of both diabetes and a debilitating gastrointestinal disorder. Intrigued? Keep watching to uncover the fascinating intersection of semaglutide and gastroparesis. Semaglutide, a groundbreaking medication for type 2 diabetes, has shown potential effects on gastric motility, sparking interest in its implications for gastroparesis patients. Gastroparesis, a chronic disorder characterized by delayed gastric emptying, presents a significant challenge in clinical practice, affecting patients' quality of life with symptoms like nausea, vomiting, and abdominal pain. The complexity of gastroparesis lies in its multifactorial etiology, including diabetes-induced neuropathy and post-surgical complications, making its management particularly challenging. Enter semaglutide, a GLP-1 receptor agonist that enhances insulin secretion, suppresses glucagon, and slows gastric emptying, raising questions about its use in gastroparesis patients. Semaglutide's mechanism of action involves binding to the GLP-1 receptor, stimulating insulin release, and slowing gastric emptying, which is beneficial for glucose control but complex for gastroparesis. Initially approved for type 2 diabetes, semaglutide's clinical applications have expanded to include weight loss, reflecting its impact on appetite suppression and caloric intake. The introduction of semaglutide has marked a significant advancement in diabetes pharmacotherapy, but its effects on gastrointestinal motility warrant careful examination. Gastroparesis manifests a complex interplay between neurological and muscular elements, leading to symptoms that profoundly affect patients' quality of life and nutritional status. Diagnosing gastroparesis involves patient history, physical examination, and specialized tests like gastric emptying studies to measure digestion speed. Treatment strategies for gastroparesis include dietary modifications, medications, and in severe cases, surgical options, but the efficacy of these treatments varies. Semaglutide's capacity to slow gastric emptying is beneficial for glucose control but raises concerns about its use in gastroparesis patients. Clinical studies on semaglutide's impact on gastroparesis are limited but evolving, with some suggesting modest effects on gastric emptying in gastroparesis patients. Anecdotal evidence and case studies provide mixed outcomes, with some patients experiencing worsened symptoms and others noting improved glycemic control. The relationship between semaglutide and gastroparesis is complex, requiring a nuanced understanding of its effects on gastric motility. Semaglutide's primary benefit lies in its robust capacity for improving glycemic control, potentially mitigating one of the risk factors for gastroparesis progression. Controlled blood sugar levels can prevent the worsening of gastroparesis symptoms and decrease the risk of diabetes-related complications. The weight loss effect of semaglutide can improve gastrointestinal motility and reduce abdominal pressure, potentially easing gastroparesis symptoms. The overarching goal in managing chronic conditions like gastroparesis and diabetes is to enhance the patient's quality of life, and semaglutide offers a convenient once-weekly dosing regimen. Despite its benefits, semaglutide's side effects, such as nausea and abdominal pain, overlap with gastroparesis symptoms, complicating the clinical picture. Certain contraindications, like a history of medullary thyroid carcinoma, must be considered before initiating semaglutide therapy in gastroparesis patients. Ongoing monitoring is essential, with regular assessments of gastric emptying times, glycemic control, and weight loss to mitigate adverse effects. Comparing semaglutide with other gastroparesis treatments reveals its unique mechanism of action, focusing on glycemic control and weight management. Integrating semaglutide into treatment plans requires a personalized approach, considering the patient's overall health profile and treatment responses. Medical experts recommend a cautious approach to using semaglutide in gastroparesis patients, emphasizing the need for further research. Patient experiences with semaglutide vary widely, highlighting the importance of personalized treatment strategies and open communication with healthcare providers. Healthcare providers face a challenging task in prescribing semaglutide, requiring thorough assessment and patient education about potential side effects. Navigating treatment decisions involves considering the latest research, technological advancements, and personal experiences of patients and providers. The interplay between semaglutide and gastroparesis presents a nuanced challenge, requiring individualized approaches and ongoing research. Future research will focus on long-term outcomes of semaglutide treatment, targeted therapies for gastroparesis, and personalized medicine approaches. Semaglutide represents both an opportunity and a challenge in managing gastroparesis, offering substantial benefits but requiring a nuanced understanding of its effects. Stay informed and empowered in your health journey. Discover more about semaglutide and its potential to transform lives. Click to learn more about our semaglutide program.